Good morning and welcome to another episode of Speaking from the Heart with Dr. Emrani. I hope that you find these sessions very useful and that you are able to share them with your social network so that others may benefit from these programs. Let's get into it. The most common question that I get asked and that you have asked on the internet and through email is, what does my cholesterol mean and how do I deal with it? Well, based on what I'm about to tell you, you will be empowered to know more about your cholesterol than actually most doctors do in the United States. The cholesterol is not just a number and it's high or low. It actually has a lot of details that go with it. So there is the total cholesterol, which is built up of your free fat that runs around the system, plus the LDL, which is the bad cholesterol, and the HDL, which is the good cholesterol. So the HDL is the good cholesterol, the LDL is the bad cholesterol. Now, this is not enough to know what to do, because our question is, are you at risk of a heart attack or a stroke, and do you need to be treated with a statin? Why do we have to answer this question? The reason is that there are no medications that don't have side effects, and all of you know that statins can have major side effects, although I strongly believe in them for the right patients. So let's find out who needs to be treated and who doesn't need to be treated. When a patient comes to me and asks me, do I need to be on a statin? The first thing I look at is their subparticles of cholesterol and the risk factors. So you have to put the patient with the cholesterol number. Now, why do the subparticles of cholesterol matter? Because if somebody has a low LDL, which means that their bad cholesterol is low, it doesn't mean that they are home free. Or on the other hand, if they have a high HDL, which is the good cholesterol, it doesn't mean that they are home free. So let's go into a little bit more detail. If you go on my website, which is laheartspecialist.com, you will see on the services that there is a section for advanced cholesterol testing. If you drop down to that bar, there you will see that measuring cholesterol alone does not provide a complete picture and can be misleading. There is a test called LPP. There are different types of LPPs, but this is what I recommend to you. And what this does is it breaks down your good cholesterol and bad cholesterol into its important particles. So the LDL, which is the bad cholesterol, has actually 7 particles. It's not one big glob, but it's actually made of 7 particles. And the HDL is made of 5 particles, and you need to know what the 5 particles are. Now, the LDL, which is the bad cholesterol, has 2 particles, 3 and 4, which are actually the damaging particles. These are the tiny particles that get stuck in the arteries of the body as the blood goes around and cause damage and cause plaque buildup. Now, on the other hand, the HDL has 5 particles, and out of those 5 particles, there's one which is called the HDL2B. HDL2B, not to be or not to be, but HDL2B, that acts like a Pac-Man or a Pac-Woman and goes around in your arteries on the walls and actually gobbles up the bad cholesterol and cleans up the arteries. So we have the LDL 3 and 4, which cause damage, and then the HDL2B that cleans up. So it's very important for you to know what numbers you have for those two. Now, once you have those, then you need to know what are your risk factors. So the highest risk factors for heart disease are diabetes, people who've had heart attacks before, people who are smokers, and people who have early family history of heart disease. For example, if your father or brother died of a heart attack at the age of 45 or 50, that puts you at very high risk, and you need to find this out. Once you have this information, then you can know whether you need to be on a statin or not. Now, a statin such as Lipitor, Crestor, Zocor, all those are medications that are the most important in terms of lowering your risk factor and lowering your cholesterol properly. There are more details that we can go into later, but this is the most important medication on the market, and you need to know about whether you should be on it or not, because once you're on it, you're pretty much committed to a lifetime of therapy. The people who absolutely need to be on a statin are people who've had a heart attack before, people who are diabetic. If you are diabetic, you should think of yourself as somebody who's had a heart attack in order to prevent one. People who are who have early family history of heart disease. Now, there are two other components that we need to talk about. One is inflammation. If your arteries are inflamed, there is a higher risk of a heart attack. So the way to measure your degree of inflammation is by measuring what's called a CRP. It's a very simple blood test that your doctor can run, a CRP. And the final thing, the test is a simple calcium score of your heart, which is a very quick CAT scan of your heart. It's not the full CAT scan, but it's a quick CAT scan that shows if you have already any buildup of plaque or heart disease in your arteries. So those four pieces of information put together with you yourself and your doctor can very strongly determine whether you need to be treated for heart disease or not. Number one, the breakdown of your cholesterol type, your LDL type, and your HDL type. Number two, your risk factors. Number three, your CRP. And number four, the calcium score if you need it. I hope you enjoyed this and you pass it along. Until next time.